Hi. This is a very interesting session, which I have been thinking of taking since a very long time. And it's basically OBG as a career option. Now, since the counseling for NEET PG is nearing, a lot of queries have come my side regarding how stressful is this as a branch, and how is the work life balance, and what do you expect as a postgraduate, or what do you expect when you enter post graduation obs and gynae, and whether DNB is equivalent to MS, and a lot of questions. So I thought I'll just do a quick review of OBG as a career option, and how or what to expect once you enter this field, and what are the future prospects, and many other things. For those of you who don't know me, I am Dr. Rena. I'm a gynecologist, and I have been in practice for almost 14 years now. I do a lot of teaching along with my practice, and as we go along, you will know more about me. Now, this is what my typical day entails apart from teaching. This is like my day in the hospitals. You have the OT, we have OPD, we have deliveries happening. I also do a lot of ultrasounds, and of course, inpatient management. So this is what um, uh, your life would look like in a few years. And this is just 50% of my life. So the remaining, I would say, 50%, and this is my professional life. The remaining 50% is devoted to teaching. I'm also I'm a lecturer, a senior faculty at Dokami. I also take my own classes. You can find me on Instagram and on YouTube. And I also am a visiting professor at a medical college. So apart from this is how your work would look like, as I said, in a few years. But let's come to the pros and cons of taking up this subject. So what are the pros? So whenever I am a very indecisive person, being a Libran, it's always been my habit, whenever I'm faced with a tough decision, is to just make a list of the pros and the cons of that decision. When I had to enter post graduation, I also was faced with this dilemma whether to take up gynae or not. uh, Although I was pretty much sure this is what I wanted to do, I was also a little bit interested in psychiatry, but finally I did decide on this subject. So always make, if you're still unsure with the counseling nearing, if you're still unsure about this as a branch, just make a list of pros and cons, and let's go through the pros. So this is just 2 days back, not 2 days back, I think a week back, where uh, I delivered two COVID babies to COVID positive mothers, and this is the happiness you get when everything is fine. The babies are fine, the moms are fine. This is the joy it brings. This is the biggest pro I feel. That's why I put it as a picture. And this is a very frequent happening. So compared to medical and surgical branches and other branches, in fact, like pediatrics, you see a lot of misery. You see a lot of morbidity, some mortality. So in obs and gynae, you see a lot of happiness, and it sort of mitigates all that's bad in this world. So that's why I enjoy this field, and seeing these bringing life in this world is what keeps me going. Okay, so this is a spelling mistake. So it's also a good mix of medicine and surgery. So for those of you who are not very sure whether to go into a medical branch or a surgical branch, this is the best option because you have so much medicine, plus you have a good mix of surgery. So it's the best branch that way. You also have a bit of radiology, you have a bit of pediatrics, it's you would have a bit of oncology. It's a very good amalgamation of everything. Also, as I said, it brings joy. You hardly see morbidities are much lesser compared to other fields, and lots of happy moments. Also, very important, another important pro is you can survive without further specialization. So although super specialization is now the norm, even following obs and gynae, many people do go into super specialization. I had the opportunity, but for personal reasons which I'll come to later, I had to forego that opportunity. But even then, even if you don't do super specialization, you can easily survive, because everyone needs, and every family needs an obstetrician gynecologist. But yes, super specialization does help. Okay. Also, if you do super specialization, for example, if you go into IVF, like reproductive medicine, or if you do fetal medicine, these are emergency free fields. It takes a bit more extra effort to reach there, but once you do, you are you have your 9 to 5 job, or however you want to time it, 9 to 3, 9 to 4, 10 to 4, and you have your fixed working hours, and you are emergency free. You don't have to be disturbed in the night. So you're like your radiology friends or your dermatology friends. um, just a little bit more effort. Once you reach there, you don't have those long working hours of waking up at night and going to deliver mothers. Okay. And it is evergreen. You can work in all setups, from the most rural area to the to metropolitan cities, to from villages to abroad, from small nursing homes to corporate setups. You can work in all setups in all places, and that's the biggest advantage of one of the biggest advantages of option. The biggest advantage, however, is this happy me, and this is on a very frequent basis. So it just uh, any difficulties you're having, or any you're feeling low, you just see these babies, and at least with me that happens, you forget everything. Okay, what are the cons? Cons is, yes, it is stressful. Okay, so the outcome is very good, but the stress involved in getting that outcome, because you're dealing with two lives, is there. So it's not without stress. It is quite a stressful job, but then the stress can be lessened to a lot of extent. It also again depends on what field you want to do. You want to be only an obstetrician, you can choose to practice only gynae, you can choose to super specialize. So, but the stress, especially as a postgraduate in the initial few years of practice, is quite high. Income is not so great, to be honest. Income, and because why, the reason is that there's so many obstetrician gynecologists. um, uh, and for example, where I practice in Faridabad, there are more than 300 gynecologists, and it's a small city. um, but there's just so many of us, and so the income is also not in it's very, for the amount of work you do, probably, yes, the income is on the lower side compared to other specialties, especially super specialized specialties. But again, if you super specialize, the income would be in proportion. So as a junior, yes, you will have long working hours, you will have odd working hours, nights will be busy, because there's no fixed time for deliveries, there's no fixed time for emergencies, they can come at any time. So, yes, the initial few years, definitely as a postgraduate, would be tough, but any field, whether you do post graduation, any field, you will be put on emergency duty. Right, so you have to get used to that any which way. But yes, even the initial few years of practice, I would say 5 years following post graduation, you will have long working hours. So you have to keep that in mind. uh, so yes, this field is saturated. As I said, there's so many gynecologists out there, so there is a point of saturation. But you can always be innovative. You can find new ways to work, new things to do in your field. And that, for example, that's what keeps me going. Okay. Fellowships and super specializations are sort of the norm these days, and yes, they are costly. So this is another drawback. Many places where post graduation is there, they don't cover a lot of things. For example, IVF, minimally invasive surgery, and that's why I always tell my students, when you're looking for a seat in a college, always make sure, because these are the so every surgery nowadays, most surgeries nowadays can be done laparoscopically or now even robotically. So look for places where these newer advancements are there. And also, for example, IVF, ART is a big thing, gynae, onco is a big thing. So look for places where you get a good exposure, all round exposure, so that may reduce the need for further fellowships. But yes, if you do intend to do a fellowship later on in life, most fellowships abroad and even nationally are a little on the costlier side. But all in all, I feel, this is my personal opinion, I feel the pros outweigh the cons. And I've been in this field for more than 14 years now. And I am definitely, I don't regret my decision at all. I'm very happy I took up this branch. I'm very happy I'm a gynecologist. My choices were slightly different compared to the usual gynecologist. but the usual path taken, but I'm very happy. So when you enter post graduation, what should you expect? And this question also I get asked a lot. They ask me what are we supposed to do and how is our working, and what to expect. So expect nothing. Everywhere is different, but the basic principle is that this is the time when you will learn the most. So make the best of this time. Every place you're in as a post graduation is a learning experience. Whether you're in the OPD, whether you're in the OT, whether you're in the labor room, every drug you prescribe you have to know in detail about it. You can learn from the nurses, you can learn. So when you go to the OT and you do a, you many of you focus on when will I get my first cesarean or when will I do my first delivery, but you forget to remember that apart from those surgical skills, it's also very important to know how to sterilize the instruments that you're using. Many of you will be very happy that you've done a cesarean. When I asked the question to the postgraduate of how, now that you're done with the surgery, how will you sterilize these instruments? So what happens to these instruments? No one, there's a blank face. Nobody knows what happens beyond. Okay, so doing the surgery is not important. Everything that happens around the operation theater is important, from the patient going in to counseling the patient to understanding the risks, understanding how to manage complications, what happens to instruments, what drugs are being given, what are the side effects of those drugs. Everything is important. The post operative care and management, so that is a neglected part. Remember, the surgery is just 10%. The surgical skill is just 10% of your learning. Also, the surgical skill is not a prerequisite. When you're looking for a place to join, remember, everything should be there. As I said, everything you see around you is a learning experience. Expect long hours, yes, and this is for any branch, not only OBG, for medicine, surgery, pediatrics, radiology, every branch. Expect long hours, expect less breaks, expect a lot of stress. Um, so this is again for all branches. This is not specific to OBG. Stress of work, stress of thesis, stress of family, stress of having to get married, stress of having a relationship. Everything is during these 3 years. Okay, also remember, apart from the stress, you'll also be doing your first delivery, first cesarean, first surgery, first counseling. You may see your first mortality. You may have to counsel, break bad news for the first time, break good news for the first time. So it's such a overwhelming experience, and it's one of the best experiences. The best 3 years of my life was during my postgraduate days. I still remember my first delivery, my first cesarean, the first gift a patient got for me. This so my first mortality, my first blunder. So everything you remember, and that stays with you. You learn from these experiences. So it's just a roller coaster ride. It's full of mixed emotions, and it's truly one. It's an experience which you have to understand, experience to understand. So, how do you choose the best place for post graduation? So, always do your research well. Go if you still have a few days, do your research well. If possible, visit those places or talk to people who are working there or in the same department to get a better understanding. Make sure that the college or the hospital you choose has a structured academic program. Many places don't. I did my post graduation from Manipal. Manipal has the most structured. After I worked in many medical colleges, I have not seen an academic program as good as Manipal. Everything was tailor made. Everything was fixed. The classes, the faculty responsible in charges, everything, who was our mentor, who were our guides, everything was very in place, unlike a lot of other places where I've seen where it's just a mess. So it has to be a structured academic program. The faculty should be interested and motivated. Okay, there are many places, especially government colleges, and I hate to say this, but yes, I have seen 80% of the faculty in most government hospitals, they're just not interested. For them, it's just a chore. It's just they have to do it, so they do it. You have to have faculty who have a motivation to teach. And yes, it's difficult to know where, but if you do your research well, you will find out. Quantity of work should not be too less. It should be a decent amount of work, so you learn a lot. Many places say that Manipal didn't have work. How, where did you learn? But that's wrong. So Manipal did have work because we were posted in the rural setups. We were sent to the government hospitals and the district hospitals where we had significant duties, and we learned a lot. So quantity of work is important. Uh, Also, language barrier should be minimum. This is from personal experience. I had to learn Kannada, also a bit of Malayalam. So make sure that you are willing, because without language you can't do post graduation. That's another reason why I didn't pick up psychiatry, because for psychiatry your language should be impeccable. You should be able to speak the language properly to understand the patient. um, so language barrier should not be there. It was such a relief when, after 13 years of being down south, when I came back to Delhi, and I could finally converse with a patient without having to think or convert the language in my mind. So think about that. It may seem a minor point, but it is definitely important. You should have a good support group. As I said, it's a very stressful period, so make sure you have friends, family, people who are there with you, people who you can go to in times of need. It does get to you at times. When I was a postgraduate, I remember in the first month itself, I just thought, I'm going to leave this place. I can't do this, because there was a senior who would trouble me a lot. But I opened up to a faculty who was very supportive, and they made sure that my remaining postings were not with that particular senior, and they gave me a lot of support. So make sure you have a good circle of people around you who will be there to help you in case of problems. Also, remember, many of you think DNB is not as good as MS. Remember, DNB is in many places. Okay, again, depending on the academic program they have and the interested and motivated faculty they have, DNB, I have seen in a lot of places, is equivalent to MS. In fact, MS in a lot of places is really bad, especially in a lot of government hospitals. Again, I hate to admit this, but yes. So, DNB, do not say DNB is worse than MS. Many places, DNB is actually better. And remember, surgical hands on exposure should not be a prerequisite. All right. So, doing knowing how to do a cesarean is good. You know how to do it, or you've done it. But knowing when to do that cesarean, or when to do that hysterectomy, or when to do what surgery is more important than knowing how to do the, or equally important, I would say, is knowing how to do. There's no point not knowing which management option would be best for that patient. um, if you I mean, if you don't know how to, what is best for the patient, then there's no point knowing how to do the surgery. Okay, so remember, again, many of you ask this, yeah, how much hands-on will we get? Will we get to operate? Everybody will get to operate. You will, if not in your post-graduation, you may get less chances. You will pick up later on. So you will eventually learn, but that should not be a prerequisite for joining your postgraduate program. Okay, very commonly asked question, what to do after post graduation. Now there's so many options. Should you go for residency? Should you do a fellowship? What should you do? Should you do super specialization? So as I said, senior residency or super specialization, and there's so many options: reproductive medicine, gynae, endoscopy or minimally invasive surgery, fetal medicine, high risk pregnancy, critical care, gynae, onco, urogynae. These are the main fields. This is what I did. Medical education. I didn't do a super specialization or a fellowship in this. This is just something which I'm interested in, and I started doing. And I've always worked in medical. I've used most of my career has been in medical colleges, and this is something which I have developed. So medical education, policy making. You can uh, go to join the government or any in many international organizations. Also research. So these are the different things you can do afterwards also, or you can do both. Okay, so by the time, as soon as I finished, for example, when I finished my post graduation, I wasn't very sure what to do. So I spent a lot of years just thinking, 2 or 3 years just thinking, what should I do? So in the interim, I joined as a assistant professor. At that time, it was not compulsory to do senior residency, so I joined directly as an assistant professor in the college where I was. And finally, when I decided to do FNB in reproductive medicine, and I got a very good rank, and I got selected. That was the time when it was time to have a baby. So that's why I had to forego my fellowship. So. time your decisions correctly. For women, it is definitely tougher. There are a lot of compromises. I am the kind of person who I thought before marriage I would never compromise. I would never let my dreams or my ambitions die. But yes, I had to put a lot of them on hold, because once you have a family, once you have children, the mother is definitely the primary caregiver. So you have to put your dreams on hold. I'm not saying don't do them, don't go after your dreams, but yeah, women are definitely more affected than men. And we have to balance work and life, family more carefully, and more. It is more of, we're more duty bound, which I hate to say, but we are, compared to the men. So men have it more easy, and that is a fact. Okay, so after that, what can you do? So you can work in a nursing home in a small setup. You can freelance. A lot of gynecologists, friends of mine who I know, freelance. You can join a corporate hospital, like what I have done recently. After working a lot of years in medical college, I joined a corporate hospital. Or you can work in a district center, or a government center, or of course you can go internationally. So there's so many options you have as an obstetrician gynecologist. Once you do your fellowships, you will be more clear of where you'll end up in. But be doing being a gynecologist, you have a wide range. You'll always have a wide range of options. Okay, now very importantly, work life balance. And this I get asked a lot. How do I do it all? How do I manage everything? So, apart from being a mother, apart from being um, a gynecologist working in a corporate setup, I'm also teaching faculty at a medical college. I am a part time faculty at Dockerby, which is an online platform for NEET PG. I am also I run my own classes. I take my lectures. I'm on Instagram and YouTube. You must have seen. I'm also a poet. I'm very soon I'm to come out. I'm going to publish a book which I've written. So uh, so I do a lot of things, and I get asked this a lot. How do you do it all? It's not easy, believe me, but you have to find. You have to prioritize and see what's important. Many things you'll miss out in life on, but yes, this is what I'm able to do. So work life balance keeps changing. When I was younger, when I wasn't married, of course things were so much easier. But once even after I got married, before the kids came, it was also relatively easier. You don't have commitments, so you can devote more time to work. But this keeps changing, keeps evolving as your life, as life events happen, your priorities change. So, obs and gynae is definitely more demanding than other departments. For example, right now, while I'm making this video, I am actually attending a wedding of my brother, my cousin brother. But I just got a call in the morning from a patient who's my booked patient, and she wants, we had planned her cesarean for Wednesday. But she suddenly called and she's like, the Pandit is saying that tomorrow is a good day for the cesarean. She wants only me to do her cesarean. So now I have to go back, drive 3 hours, do her cesarean tomorrow morning, come back, attend the wedding. So it is more demanding. I can't just it becomes it's a, so once a patient comes to you, especially a pregnant patient, and she's booked with you, you develop a rapport with her, and she expects you to be there at every stage of her pregnancy. And that is something which I love doing. I love getting involved with the patient, with her family. I also like knowing about, because that helps me as a doctor treat her better, understand her problems better. I see a lot of women who come to me with domestic violence problems, and empathizing with them is very important. So it is more demanding than other departments because you get very involved with these patients. And of course, deliveries keep happening at any time. So compared to other departments, more demanding. But after the initial years of struggle, a lot depends on how you want it to be. So uh, I could choose to, I could have chosen to say no. My junior consultant will do your cesarean, or I could choose not to practice obstetrics, just do gynecology, or not go into private practice at all. Be happy in a medical college. So it depends on how you want it to be. You can just have a 9 to 4 job. Many of my friends have done that, and they're very happy with the uh, how they've done it. But um, uh, you a lot of so a lot of how you balance your work and life depends on uh, how you want it to be. So you can do everything. It doesn't, you don't have to, you don't have to be on your feet at all times. But yes, the initial few years are a struggle, and then you can be very work at your will. And as I said, it is tougher for women. From my own experiences, I've told you, but now is a time when I've once my family, the kids are a little bigger, you understand that you can give more time to work. But in the end, women are primary caregivers for their family. You face a lot of criticism, a lot of negativity from people around you. Men have it, as I said, easier, but that's for the men to say. Women have a lot of other things to think about apart from work. So I hope this gives, especially for this is for those who asked me specifically about this question. I hope this gives you a better idea about how to manage work and life. And just to before I end, I'll just take you through a journey about myself and how I went about this. So I did my MBBS in 2000. Then I did my post graduation between 2006 2009, and then I worked in Nepal and KMC in Mangalore as a lecturer and an assistant professor for 4 years almost. And this was the time when I was deciding what to do next, and this is the time when my husband was pursuing his super specialization, and I was very unsure what to do or how to. This is like a very confusing stage for me. Then I am from Delhi, so we moved back to Delhi after my husband completed his super specialization. I worked as an assistant professor in Lady Harding Medical College, and this is the time when I also got selected in reproductive medicine, and I had to choose was going there versus baby number one who came along in 2015. So I chose baby number one, and then I joined as an associate professor in a medical college in Faridabad, and also came along baby number two. So all this while from 2009 2020 I was working in medical college, so I have a lot of teaching experience. But in this is the year when COVID struck, when I took a sabbatical, and I felt that medical college was going nowhere for me, and I needed to explore new options. So I joined Akash NEET PG division. I think they're still yet to come out with their app, but I joined there for about a year, and that's when I realized I can do a lot more, and I started dabbling in online teaching, along with continuing being a visiting professor at the medical college. And in 2022, sort of reached a bit of stability. COVID, the lockdown got over, schools opened, my children started going to school. So finally took the plunge, joined the corporate sector, plus joined Docomi as a part-time faculty, plus writing a book, plus doing my online teaching. So a lot of things have worked out for me, and I'm finally getting to do what I wanted to do. So this is how um, my journey has been, and for everyone it's different. Many of my friends immediately after post graduation 2009 they went straight into private practice, and it's very few ventured into medical college. In fact, from my batch, I think I'm the only one who stayed back in a medical college. The rest all went either abroad or in private practice. A few did FNB immediately after. So but everybody is doing so well, and everybody is happy, and so everybody's journey is different. It's very difficult to say to look into the future 10 years hence, and see what you'll be doing. But take one step at a time and have the courage to follow your heart and intuition. They somehow know what you truly want to become. I always wanted to become a gynecologist. I knew it deep inside that this, when I used to go for my clinics as an undergraduate, and I used to take case presentations and see these women and attend deliveries, I somehow knew that this is what I want to be, or what I want to become. So have the courage to follow your heart. Your heart will guide you best. And good luck to everybody. And I hope this session does help you. If you have any queries, you can write in the comment section and I will get back to you. Thank you.